the team manager of the Forensic Support Service, which is a community team in CWP. And we work with individuals who have got a diagnosis of autism, learning disability, or mental health difficulty, and who might be at risk of going into prison or going into a secure hospital. And we work with community teams to try and reduce the likelihood of that happening. The first thing I think that's a really important message to give is that individuals with diagnosis of autism are no more likely to commit a violent crime than the general population. And I think that is a myth sometimes that is perpetuated within the media. In fact, autistic individuals are more likely to be a victim of bullying, of harassment, and of crime. And we as healthcare providers need to think about how do we reduce the barriers for individuals with autism and learning disability to be able to access healthcare, because unfortunately we know that the outcomes for individuals with learning disability and or autism are worse than the general population and are more likely to die earlier. So we need to think about how can we avoid that happening. Today we're going to focus on a really interesting article that was published in the British Journal of Hospital Medicine in 2023, and it's called Autistic Space, a novel framework for meeting the needs of autistic people in healthcare settings. And you might wonder why we're focusing on that article when we're talking about personal safety. But in fact, in order to promote personal safety, we need to think about how we are facilitating people's access to healthcare. And when we look at the different areas of this article, it hopefully will help you think about the ways that you can change practice, which will result in better personal safety for the person accessing and also for you delivering that care. The author's aim was to create a really simple framework promoting accessibility without adding to clinical burden, and they've called it the autistic space. The first facet that we're going to look at is sensory needs. So we know that individuals with an autism diagnosis experience the world differently than non-autistic adults. And if you are non-autistic, you need to understand that the person is experiencing the world differently to you, or at least have an understanding that that's happening. So a person's sensory responsiveness can vary depending on the situation that they are in. So you could see somebody in their own home and they could be very different to them when you bring them into a healthcare setting. And so that could be that the sensory profile within that environment has changed and therefore they are finding that more difficult. What happens then is that if someone has a sensory overload, then that can result in what can sometimes be called meltdowns or shutdowns. And that's when an individual has found the world around them just too much and too difficult to kind of be in. And that can sometimes then lead to us focusing on and calling that challenging behaviour. And what we need to think about is how has that behaviour got to that point? What is it from a sensory perspective has happened to that individual that has then resulted in that behaviour? And so what we can do then is ask the person, do you have any sensory needs that I need to be aware of when I'm working with you? Or if they're not able to communicate that, do they have a carer or a friend or a family member that you're able to ask? And knowing that information early then enables you to then be able to adapt either the environment that they're in or the way that you're working with them. And the reason that then links back to personal safety is if you know that you're able to change the profile of the environment for that individual, that they're going to feel more comfortable in it, that they're going to have a better experience within that, then you're less likely then to see challenging behaviour, which then is going to keep everybody safe in this situation. So, for example, there are things that you could do where you could change the lighting or switch off artificial lights. Is there a way that you can just open the windows, open the curtains, let kind of fresh air in? Is there a way that you could see the person in a different room, a different environment than what you might normally use? So seek out that information in advance, make those adaptations, and you're likely to have a better outcome in that situation. So the next topic that we're going to think about then is predictability. And without a doubt, autistic individuals need predictability. And if that's not achieved, then what can happen is a rise in anxiety levels. And again, if we're thinking about personal safety, if you've got somebody who is got extreme anxiety, then again that might lead to challenging behaviours and it decreased safety for the individual themselves and the person providing the healthcare. So again, what can we do to make the situation more predictable for that individual? So what information do we give out before the appointment? Does the person know where they're going, who they're going to be seeing? Could you provide a video of the environment? Could you provide a picture of the person that they're going to be seeing? Think about if you've got an appointment at 10 o'clock, that appointment needs to happen at 10 o'clock, because as soon as it goes past 10 o'clock, the person may be becoming more and more anxious. So by the time you see them at 20 past 10, actually they're too anxious then to be able to engage in that appointment. If you are running late, communicate with that individual in the way that they will understand. So can you ring them and let them know? Apologise for being late, explain the situation, ask them, do they want to rearrange it, because actually you're not going to get there in time. So again, go back to the individual, find out what their communication needs are and work with that. This was another good tip around predictability, is thinking about if a person does have to wait, can they wait in their own environment? So can they come in and say they've arrived for their appointment, but actually go back outside and wait in their car? Can they wait in the space outside, so that then they're not having to sit in that waiting room that they may be finding overly stimulating? The next facet that we're going to look at is acceptance. And this is a really important aspect of autism, is that we need to be aware of autism, but we need to start accepting it into practice. We need to think about how we change the structures and the systems within healthcare, instead of expecting the individual with autism and learning disability to change. And so we need to think about that by doing reasonable adjustments, and also what's called the Green Light Toolkit, which is a toolkit for people with learning disabilities to access healthcare. We need to be thinking about how do we educate ourselves around neurodiversity. So if we know the way that we need to change our practices, then that's going to make access to those services better for those individuals. We need to also understand distress behaviour. We need to understand anxiety. We need to understand why the person is presenting in the way they are to us, because of how they are seeing the world. And if we can start to understand that and appreciate that, then we can start making those changes. Now we can go on to talk about communication. So we know that individuals with autism or learning disability can communicate differently. The first thing to do is to ask if they have what's called a communication passport. And if they do, use it, read it. Make sure that you know the communication style that person prefers. Keep your communication clear, keep it concise. Don't use acronyms. And if you do use acronyms, explain them. Make sure that you are checking out whether they've understood. Non-verbal communication can be different as well for individuals with autism or learning disability, and don't assume understanding. So make sure that you check out with that individual. So don't assume understanding, check it out with the individual. And also another aspect is that if somebody is in a highly anxious state, if they feel kind of overwhelmed by the situation that they are in, that is going to have an impact on their ability to communicate, or their ability to retain the information that you are giving them. So maybe think about, do you need to provide that information in a written format or a pictorial format, or maybe that you might need to write to that person afterwards and give a summary of that consultation, because they may not have been able to retain it verbally when you've met with them. Okay, the next aspect that we're going to think about is empathy. And again, this is a common myth, I think, within the media, that individuals with autism lack empathy. And again, that's not always kind of true. It may be that it's experienced or demonstrated differently. And actually some individuals with autism can experience such depth of empathy that feels overwhelming. And so understanding that will help you be able to work with that individual as to how they show empathy and how they feel what you're going through with them. So asking, again, it's about communication, it's about asking the individual, it's about talking directly about things, and it's not making assumptions based on the non-verbal communication that you are seeing. Working with an individual and having shared understanding, shared goals for treatment, and a shared treatment plan is going to result in better outcomes for everybody. So the last facet then that we're going to think about is space. And in the article, it divides space into three areas. So physical space, processing space, and emotional space. So physical space is what it says on the tin. Giving somebody as much physical space as they need, and remembering that they may need a greater amount of space than perhaps you might feel that you might need. So again, thinking about waiting rooms. So sitting shoulder to shoulder to other people in the waiting room may feel overwhelming for that individual. So is there somewhere that they can wait that gives them more space? Somebody may need to pace, they might need to move around, they may need to kind of feel fresh air as they're waiting. Can that be facilitated? So think about the space that you're seeing them in. I know some psychologists that will work with individuals outside, that will go for walks together in order to facilitate that treatment, because actually that individual finds open spaces much more accommodating and kind of helpful. Avoid touch. And again, this is by know your client, know the person that you're working with. If they are feeling overwhelmed, if they're feeling very anxious, your first response might be to put a hand on their arm to sort of show empathy. In fact, that might actually escalate the situation. So again, give somebody space, allow somebody to pace, to move about, because that might be what they need at that time. The second concept of space is around processing space, and this is really important when you're working with somebody with an autism diagnosis. You could ask a question and the person doesn't respond. So you assume they haven't heard, they don't understand, so you ask that again. And what you're then doing is overloading that person, because they are still trying to process the first question that you've asked. And by asking a second question, they're now processing two sets of questions. So give somebody time and space to think about what you've asked, to think about their answer before they give it. So don't assume that just because they're not answering you, they haven't understood. It may be that they have a longer processing speed. And then the last area is emotional space. So again, this is if somebody is feeling overwhelmed, if they are in a high state of anxiety, what they might need is time and space to process those emotions. So it may be that the time that you might need to rearrange your appointment with that individual, it might be that you need to give them 10 or 15 minutes to process those emotions before then you can start your piece of work with them. So again, being aware of what that emotional space is needed. So those are the 5 areas of the autistic space acronym. So sensory, predictability, acceptance, communication, and empathy. And I think that if we can introduce this into our practice, if we can think about those 5 areas when we're working with individuals, that is going to help promote personal safety within the work that we are doing for the individual and for ourselves. Because if we can make healthcare more accessible, the likelihood of challenging behaviour reduces. Okay, so my 3 takeaway messages then is, number 1, increase your understanding of neurodiversity. So it's for healthcare to change, not the person accessing healthcare to change. So if we understand what a learning disability is, what autism is, what ADHD is, then we can start thinking about how do we facilitate access to healthcare for individuals. The second top tip is don't be afraid to ask the person. So use their communication passport if they have one, use their positive behavioural support plan if they have one, and make sure that you are implementing that into your practice. And my third takeaway message is to keep calm. Think about what you can do to reduce the anxiety that that person may be experiencing. Talk to them prior to your appointment as to what is going to help facilitate the best outcome for that individual, and think about how anxiety can lead to challenging behaviour and what you can do to prevent that from